Hello, everyone. Welcome to another episode of Equilibrium. This is our women's health series. And today I'm so excited to be talking with Dr. Hack. She's a board certified OBGYN and also a podcast host of the Lady Parts Doctor. How are you, Dr. Hack?
I am well. How are you?
Doing well. Thanks again for being on the show.
Thank you for inviting me. I love to talk, and I love to talk about women's health topics and topics for anybody who has a uterus, vagina, and so on and so forth. So thank you.
Yes, let's get into it. Tell me a little bit about you. What's your background?
Sure. So I am a board certified OBGYN. I was drawn to women's health in particular as I want to say in elementary, middle school, when I started to experience, going through puberty and the body changes and getting a better understanding of my own body. Like I was just always interested in the topics like, oh, tell me more about periods. Tell me more about breast development. So I decided that I wanted to be a physician when I was in high school, and I went to undergrad, took a couple years off and worked, and then went to medical school in Philly, love Philly. And that's where I decided, okay, after medical school, for sure, I want to be an OBGYN. And that's what I did. So I was in full-time clinical practice. And one thing that I've always loved is speaking, and I wasn't doing that so much. So I left full-time clinical practice a few months ago, and I've been focusing more on sharing the information, discussing evidence-based health information and health topics, because that was always my favorite thing with my patients, is sitting down, having the one-on-one conversations and making sure that they were equipped with the information that they needed to make decisions. And as you know, I'm sure there is so much misinformation out here.
Yes.
And there's so many people who are just sharing things that aren't necessarily true, and it causes a lot of stress and anxiety,
confusion.
Right. So, and also there are a lot of things that are considered taboo that people don't feel comfortable talking about. And I always loved being able to talk about these otherwise taboo topics and just make people feel more comfortable being who they are. So, what other things can I tell you about myself? I like to garden. I have 2 children, and I'm pregnant with a 3rd.
Oh, congratulations.
Thank you. And a lovely husband. I can't forget about him.
Oh, don't forget about him. Of course. Well, I love, that's me. Yeah, I love doctors like you who are willing to talk with, you actually sit down and talk with your patients. I find that it's so hard to find just a doctor that truly cares and wants to educate their patients. I talked with quite a few of my friends during the pandemic, just when everyone had like a lot of time on their hands, and just researching women's health topics. And there's so many things, like you mentioned, finding out about your period, and there are so many things I didn't understand, like the cycle and how all of this stuff works and how everything has to just like fall into place for it in order to act right and to be correct. So yeah. I mean, there's so many. Is that so? What's the topic that you're most passionate about with women's health? What do you love to talk about?
It changes for me. And I found that as I go through, I identify as a woman, I'm a Black woman. So as I go through my life and I experience things, I become more passionate about that. Like those topics are often the things I like to talk to people about, because, I'll give you an example, like miscarriage. I have my own experience with miscarriage. And so I like to talk to people about it because, for one, it's just now becoming something that people talk about regularly, but then also as they're going through it and dealing with it, I can also give them support and encouragement for my own experience. So it's always changing for me, but I like talking about cervical cancer screening. That's a big one. And pap smears. And I like talking about periods. I will talk about just about anything, birth control.
Any topic. I love it. Yeah. What would you say? So I'm just going to ask you all these questions about your job. So what would you say is the most challenging part about being an OBGYN, or just in this practice, in this realm? with health?
The most challenging part, I would say, is more like the pregnancy loss part.
Mm-hmm.
As OBGYNs, for many of us who are generalists, meaning we still provide gynecologic and obstetrical care, it is really great to help somebody who wants to be pregnant get through a pregnancy and deliver a healthy baby. It is not great when that is not the outcome. And I think that is the hardest part, or when people are trying to get pregnant and having a lot of difficulties getting pregnant, or getting pregnant and they don't want to be pregnant,
Right.
like that's, I think, probably the hardest thing is when you really bond and connect with your patients, you are going through these life experiences with them and you really want them to have the outcome that they want, that, at that particular time in their life. So that's the hardest thing, I'd say.
Okay. Yeah. And you mentioned, I think it's a great segue into my next question is you mentioned, getting pregnant, not necessarily wanting the pregnancy or, struggling to get pregnant or just anything dealing with pregnancy. Recently, Roe versus Wade was overturned.
Right.
I just want to get your thoughts on that. What's going through your mind right now?
Man, well, people who support abortion have been preparing for that. The signs have been there, over years, as states have been slowly making these very restrictive laws and creating these trigger laws, meaning these laws that would automatically ban abortion should Roe v. Wade be overturned. So the signs were there. I didn't realize that it was going to happen so soon, but a number of people did and have been preparing for that. So, for me, it is just a blow to reproductive rights. My goal, and I think for many of us as OBGYNs, if you identify as a women's health advocate or a reproductive health advocate, you just want people to feel empowered and to be able to make the decisions regarding their health that are best for them. And when you start involving laws from people who know nothing about the topic and don't really have a good understanding, it really complicates the process. And for physicians, we take an oath to do no harm. And this could potentially and is causing a lot of harm. So I didn't think it was going to happen so soon, but we had a feeling it was coming, it's crazy, right? Because Roe v. Wade had been a law for almost 50 years. Yeah. So it's crazy to say now, as we feel like as the time progresses, we are becoming less progressive.
Yeah. I mean, when I heard it, I think I was just, sitting in my living room. To be honest, I teared up. I cried because it's just, I don't know. I knew, yes, with the trigger laws and, certain states are doing, X, Y, and Z, but I agree with you. I didn't know it was going to happen so soon. I don't know. I was very surprised by it. Yeah. How's the conversation? I know you said you're out of the practice now, but I know you have your podcast, Lady Parts Doctor. How are you sort of communicating this and sort of, helping people to kind of digest this and, what's happening in our country right now?
Sure. So when it first came out, I just kind of stopped what I was doing and I was like, all right, I need to talk about this because people don't fully understand what Roe v. Wade was and what Roe v. Wade being overturned means. So essentially, I think a lot of us have a better understanding now, but in case you don't, Roe v. Wade basically provided federal protections for abortion rights. And now that Roe v. Wade is overturned, it has pushed everything back on the states. So now those decisions are going to be made at a state level. And with all of the political changes in states, really states are now becoming, a red state, a blue state specifically, instead of kind of being diverse and having people that are going to vote differently. So for states that are more red, we'll say, for example, they're more likely to make very restrictive abortion policies, abortion laws, if not making abortion illegal. And many of them have. And I've started talking about that and now I forgot what you asked me. It's a little pregnancy brain too, I guess.
Yeah, I asked you, how are you communicating and helping people kind of deal with it? And
right. So, for me, fortunately, I also live in a state where those changes, I do not live in a state with restrictive abortion laws and policies. So what I'm trying to do is help get the message out there. Like now we're kind of, we're doing, not catch up. That's not what I want to say, but now we're like, okay, how can we prepare you with what your options are? So what is available to you? Because you are never powerless. There's always something that you can do. And I think that is a very important message to get across to people. So there was another physician who has a very powerful social media presence who started this campaign, 3 for Freedom, letting everybody know that, there are 3 things that you can do to prepare yourself. And this was before they announced the verdict, but once we knew that the verdict was probably going to be announced. So that's getting a birth control that works well for you and getting enough of it to last for you. 2, the second thing was access to emergency contraception. So storing up an emergency contraception so you can have it if you feel that you need it. And then the third thing is access to medication abortion, which many people can obtain through aid access, but also through a prescription potentially from your healthcare provider. So it's kind of like now we're on the defense, like, okay, let's prepare. These are some things that you can do. And then also I'm encouraging people to vote, primaries and with gubernatorial races, all of these things matter. Like, we just think about voting for the president, but you really realize, especially I think in the last 5 years, 6 years, we'll say, just how important it is to make sure that we are electing people who support our views. And that's really what I've been doing, speaking about birth control, just putting out as much information, even sex education, right? Because some of that information is lacking as well.
Gosh, yeah. One thing that, came out of this, or that I was particularly worried about, was the period tracking apps and the health apps that we have on our phones, where we're putting, we're tracking our periods, we're putting in different things like pregnancies, things like that. So what are your thoughts on that? Where they're saying, they can sell your data, you can potentially go to jail. Like, what are you thinking?
I'm like, oh my gosh, it sounds like 1984. Right. I don't know if you ever read 1984.
Yeah. I'm like frightened.
Yeah. I mean, it's something I hadn't thought about. And then once the law was overturned, I started seeing articles and they're talking about it. And, the fact that women and people who can get pregnant have been prosecuted for murder for aborting pregnancies. So it is a serious thing. And I know Flo came out and announced that they would be allowing people to navigate their app anonymously, which is great. Data can always be sold. I think I had a post about it on social media and someone was like, they're not going to do that. And I'm like, unless you can go and assure every single person that nothing is going to happen to them, like, we can't just say this won't happen. Many of things have happened that we didn't think were going to happen. So I think it's just a matter, again, of protecting yourself or, taking precautions whenever you can. So navigating apps anonymously, not putting in all your personal information and, personal identifiers, I think is key. I sincerely hope that doesn't happen. That's all I can say. Yeah. I hope that doesn't happen.
I hope not. I mean, that would be crazy, for lack of a better word.
It would be a sci-fi novel. Yes. This dystopian society where the government is tracking and arresting you. I mean, and that does happen for other things, but this criminalization, I think the fact that they're turning abortion into a felony, in some places, or even for assisting people with obtaining an abortion, a felony is, that's more than we would have imagined could happen. Does not bode well for us.
Not at all. I wanted to talk a little bit about cases or instances where you've, have not a success story, but a case where an abortion has saved someone's life, and just the sort of importance of why we need access to abortion.
Sure. So I think for me, what comes to mind are the patients that come in with pre-viable, meaning pregnancies where the baby cannot survive outside of the womb, pre-viable pregnancies with either a lot of bleeding or their water has broken, which then opens up the uterine cavity to potential infection, right? Because that bag of amniotic fluid that the baby sits in is closed, it's sterile. But once it breaks, it's open and things can pass from the vagina into the cervix, into the uterus. And so there are cases where, we've had a patient break their water with a pre-viable baby, we'll say like 18 weeks, for example, and they get infected. That pregnancy needs to end. That baby will not survive. And if that pregnancy continues and the mother gets very infected or the parent gets very infected, they will not survive. And, that's a very difficult situation, right? You have someone often with a very highly desired pregnancy. They're already in their second trimester and you need to terminate the pregnancy. It's a life-saving measure that we have to take. And so now getting laws involved in this, that affects our ability to give care that we know is going to be best for the patient and allow that patient to get pregnant again, in the future. Or, sometimes that same patient might come in with a lot of bleeding and they've broken their water. There's a lot of bleeding and the pregnancy needs to end. So those are, some of the kind of more common cases where we have to terminate the pregnancy.
Got it. Okay. Now, I know there's different types of ways that women or, people can have access to an abortion. So I know there's an abortion pill.
Yes.
Right.
So
can you talk a little bit about
abortion. That? Yeah. So with medication abortion, there's a pill that you can take. You'll find I've done a podcast on this, like a lot more details to terminate a pregnancy. Okay. There's also a surgical procedure that can be performed to terminate a pregnancy. So medication abortion is something that's going to be performed earlier on. And then a surgery would be something that would be performed later in pregnancy. And those are both available at like a Planned Parenthood. And then, of course, we talked about the pill is available through a prescription from your healthcare provider, potentially, or an organization like Aid Access. Whereas a surgical procedure, you'd have to actually go in to see your provider to have the procedure performed. And, as OBGYNs, we are trained to be able to do this. Many of us, it's training that you can opt out of, but because we know that it's something that we may have to do that's a life-saving measure, many of us elect to train to be able to provide care. So those are your options.
Got it. Okay. Well, you mentioned that you talk a little bit more in depth on your podcast. Talk to me a little bit about why you wanted to start this podcast.
Oh, sure. I love talking about these topics. And I think I touched upon before, I just love introducing these topics that you might not have a conversation about otherwise. And you might go on living your life just kind of having no idea, is this normal? Right. And I'm always hesitant to use the term normal. But you know what I mean? Is it okay that this is happening?
Should I let this happen or not?
Exactly. And so I wanted to have a space to just go into depth about various topics, various things, just to be able to do it. And maybe someone will listen and get some more information that they'll say, you know what, this is helpful for me. I now have information that will help me make a decision elsewhere. And it's really kind of a total health thing. I talk about physical health things, but I also focus on mental health. I also focus on spiritual health because I think all three are necessary for really being healthy.
Got it. Yeah, I agree with you. I'm going to listen to all the episodes. One last question for you. I just, yeah. What do you hope for the future of women's reproductive rights?
I just hope the power comes back to the people.
Yeah.
It's, these are decisions that nobody takes lightly.
Mm-hmm.
And the interference of the government, whether that be your state government or the federal government, into your ability to make decisions about your body and your life makes no sense, because nobody understands it like you.
Yeah.
Nobody understands it like you. So that is my hope, that they can find a way to either federally bolster access to abortion, because it is healthcare. And I think there's been a separation, but abortion is healthcare.
Mm-hmm.
I hope that people just get the power to make decisions, because I will be very clear. People who identify as pro-life or anti-abortion also get abortions. Mm-hmm. Oh, they do. Mm-hmm. Mm-hmm. But there's a disconnect, right? Like they think, in my mind, they must think, oh, well, but this is my circumstance and my circumstance is justified. Right. And so it's very difficult to insert yourself into somebody's life to know exactly what they're dealing with, to try to justify their decision or determine if it's, a decision worth making. These are just very personal decisions that people are making that aren't taken lightly. So that's my hope.
Well, I'm right there with you. I agree. Dr. Hag, I appreciate you talking with us today. Tell people how they can find you online.
Yes. So you can listen into the podcast. It is the Lady Parts Doctor podcast. You can find it on ladypartsdoctor.com, which is my website, Lady Parts, and spell out DOCTOR.com. The Lady Parts Doctor podcast is also available on Apple, Spotify, Audible, Amazon, Stitcher, TuneIn,
everything.
And then you can follow me on Instagram at ladypartsdoc, LADYPARTSDOC. And I, as Bria was mentioning, I'm like regularly posting reels to promote whatever the podcast topic is. And then sometimes just silly things, because it's social media. So why not?
I love it. I was telling her I have to get better at mine, but that's another conversation for a different day. I appreciate you, Dr. Hag, for being here. And hopefully we can have you back on the show.
Yes, I'd love to. I mean, we know the environment is ever changing. And so there's always something to talk about.
Hopefully we have a follow-up episode where they reinstate Roe versus.
Yes. Then I will have my glass of wine that I can sip while we talk, and I will not be pregnant.
There we go. Oh my gosh, this sounds so fun. I hope to see you soon. Thank you.
Thank you. Take care.